We shift gears and talk about mental wellness, and we are taking this conversation with none other than Dr. Mercy Karanja, who is the head division of mental health at the Ministry of Health. Thank you, ma'am, and thank you very much for making time.
Thank you for having
me.
So
paint a picture in terms of the status report of Kenya, where it stands when it comes to matters of health, mental health.
When it comes to mental health in Kenya, indeed, we're experiencing quite a number of mental health challenges amongst the population, and we have found that about 25% of Kenyans will suffer from one kind of mental health condition in their lifetime, and they are struggling with mental health issues. We have people dying from suicidal cases. We have about 4 Kenyans every day dying from suicide. And we found that even when you look at the working population, 15% of the Kenyans who are at work are suffering from a mental health condition. That translates to about 3.7 million Kenyan. And this is costing Kenyans about 62 billion Kenya shillings annually. That's about 0.6% of the GDP.
Wow.
So indeed, it's a rising issue of public health concern, and it's something that we really need to address as a nation.
Well, the social economic impact of mental health to the country.
Yes.
Now, if you're looking at that particular demographic of those who are actually taxpayers, so to speak, those who are in the workforce, 3.7, that's quite a number.
Very
then
true.
What are the most common, mental health issues affecting these Kenyans that you've mentioned?
Mental health conditions are quite a number, over 200 mental health conditions that we can talk about as mental health professionals. But what we see common in our society is conditions like depression, which is characterized by individuals experiencing persistent sadness, loss of interest in many things they used to enjoy, feeling hopeless. Conditions like anxiety disorder, where persons are feeling restless the whole time. They're not able to stay still. They are always maybe having panic attacks. We also have seen quite a high number of persons who present with addiction problems, especially alcohol and substance abuse. And we are finding that about 10.5% of Kenyans are using either alcohol or drugs, and they are even suffering from alcohol and substance use disorders. We also have suicide as an outcome of mental health conditions. We have people suffering from what we call schizophrenia and psychosis, and quite a number of people also suffering from bipolar disorder, which is a condition where we have some people having very high moods, alternating with episodes of depression. But there are still other conditions that we are seeing, including post-traumatic stress disorder, which is experienced after someone experiences or witnesses a traumatic event.
Quite. That's a vast array of forms of health issues affecting Kenyans.
Yes.
From a professional point of view, do you think that we have done enough to have an inclusive approach, on matters mental health when it comes to public health? Because there are critics who've come out and say that it is often overlooked. What's your take?
Well, historically and globally speaking, really, mental health has not always been on the front line. It has been an area that has not been of keen investment. But I cannot say we are taking the back seat and just let it go. Yes. There's a lot that is happening. And I think even when we had COVID-19, it even increased the efforts to address mental health issues, and the government is doing quite a bit of work to address this public health issue of mental health.
So what would you say are the key milestones of Kenya's mental health policy 2015-2030?
Some of the key things is, first, we are working on integrating mental health in primary health care. This is going to increase access to mental health services. We are doing advocacy and awareness creation so that Kenyans are aware of the need to promote mental well-being and prevent mental illnesses, and even seek for support and care when they are affected. We have brought in mental health to the workplaces. We have a guideline of workplace mental wellness, and we are supporting institutions, both in the private and the public sector, to implement this so that we have better care. We are improving service delivery. In fact, now we have better medication available even at lower level mental health facilities or even non-mental health facilities that improve outcomes of mental health conditions. We're embracing technology by using telemental health to reach the marginalized people. We have done quite a bit of work also in terms of increasing the human resource for mental health, but we still have quite a gap. So a lot of this is going on. And if you recall, there was a task force on mental health that was appointed in 2019, and they gave 15 recommendations to the head of state. And out of those recommendations, most of them have been achieved, and these are seen mental health becoming a priority. But as I said, we still have quite some way to go, and we are still working on that.
Now, some of the inroads that have been made is that we have seen a change in policy, especially when in law, and I'd want you to unpack that for us. What impact has the decriminalization of attempted suicide had on, mental wellness so far?
That was a very good, outcome for that case for Kenyans, and it was a landmark ruling, really, in the mental health space, because unlike or contrary to what Kenyans think that we'll see an increase in suicide cases, we are really going to see an improvement in the mental health space, in that it helps people realize that this is not treated as a criminal case. It's not, you're not diverted to the criminal justice system, but it's a health issue. And people now will be able to talk about their struggles with suicidal thoughts. The community will embrace these people not as criminals, but as people who are in need of health interventions. So there will be better health-seeking behavior. There will be less stigma when somebody has suicidal thought, and there will be better interventions and care and support for those who are struggling with suicidal thought. So it's a win.
So tonight, if you're watching Sunday Express, you want to hear your feedback, you can get us on X at KBC Channel 1. What's your take on how we are so far handling matters of mental health in the country? The statistics are very grim. It indicates that 1 out of every 5 Kenyans is likely to experience one form of mental illness or another in their lifetime. The workforce, we're looking at numbers at around 3.7 million employees, or rather those in the workforce, are dealing with anxiety, depression, name it, costing around 62 billion shillings per annum from the economy. So this is something, and experts have come out and even said, I can quote psychiatrist Franklin Njenga saying that mental health issues is actually a time bomb that is already unraveling. What's your take? Get us on X at KBC Channel 1. My X handle is at Ray Manyara. Now, Dr. One of the few issues that have been brought about by some of our viewers here, and I want to read this question. When someone says that they want to kill themselves or take their lives, at what point do I take them seriously?
The moment they verbalize that, you take them seriously.
All right.
It is not, they're not seeking attention just to make you, give them some time. They are really crying for help. So it is important, if somebody has verbalized, expressed that they no longer feel the need to live, speak to that person, give them some of your time. If need be, connect them to a mental health professional, because that is how it starts. And a lot of people who actually die by suicide have told somebody in the past of their intent to end their lives, but the person just did not do anything.
Now, looking at the workspace, there's so many other underlying issues that actually lead this workforce to experience either depression, anxiety, and that is they cannot actually fend for their families. The financial burden is one of the key areas that is leading people down this road, the abyss, so to speak, when it comes to mental health. We've seen government come up with various programs to even improve communication skills at the Kenya School of Government. Do you think that this is the right time to actually include matters of mental health, building capacity among our leadership in these particular offices to avoid such incidences? Indeed.
It is the right time. It is long overdue, because we spend most of our time at the workplace.
Yes.
And if your workplace is not good for you, then definitely it's going to impact negatively on your mental health.
Actually, we call it a toxic work environment.
Exactly.
Yeah.
It will impact negatively. We need the work, because having work is healthy.
Yes.
It's good for your mental health. It's good for your pocket. It's good for your family. But equally, a negative work environment is also damaging to your mental health. So we need to invest in the workspaces, the work that we give people, because there are many factors in the workplace that can actually affect your mental well-being. Not just the space, but even the workload, the type of work, the relationships that you have in the workspaces, all right? Those are the things that can actually impact on your mental health. So it is important that human resource managers and people who are in leadership, managers, and even co-workers need to be mindful and to be intentional of promoting mental well-being and preventing mental health conditions. And on top of that, providing a supportive environment that accommodates even those persons who are struggling with mental health conditions. Because having a mental illness does not necessarily mean you cannot regain your mental health. You can regain your mental health and become fully productive and continue with your work if you're well supported.
How do we show up capacity on an individual level? What advice would you give to a person who is in a toxic work environment? Because I mean, we're looking at 3.7
It is
million
very
Kenyans.
important that you speak about it at the workplace, and it is your right to ask for a good working environment. And even our law, our Mental Health Act, was amended in 2022, and with deliberate effort to make sure that the rights of persons with mental health conditions are also considered. So similarly, if you look at our guideline of workplace mental wellness, we insist that you as an individual, you have a role to play. Do you take time off? Have you built coping skills for yourself? Do you have
now
a
those
support
coping
system?
skills is
Yes.
where Dr. I want us to
Yes.
show up capacity on, because for instance, in the media sector where we find ourselves, we work long hours, we're dealing with different people every time.
Yes.
When we are having mandamanos, we're there. When we are reporting murders, killings, rape, defilement, we are in the thick of things. We have to process that and unpack it for the viewers. Such is the environment. How do we show up capacity?
Yeah, that repeated trauma can actually expose you to mental health problems, and it is important you take some time off. When you feel that I cannot take this anymore, it is important to know what is your limit. Just like the same when it happens to your phone battery, you notice it has reached 35%, and you're like, I need to recharge this. Treat your mind the same way you treat your phone battery, so that it doesn't run low, that it cannot serve you anymore. Then talk to somebody. It's important to realize when you need to talk to somebody about your mental health. The same way when you start having body aches, you say, it's time to see a doctor. I'm not going to give myself some painkillers anymore. Learn to ask for help from other people. Learn to take breaks. We are given leave days from work so that we can utilize them to rest, to recharge. Some people don't take leave. And it's okay also sometimes to say, this environment is not for me.
It's not working.
It's not working for me.
Then brings the crux of the matter, stigmatization. When we talk about matters of mental health, it also boils down to stigma, cultural, related, and such, that if I come out and say, Daktari, that I'm struggling with 1, 2, 3, or I approach my boss and I'm struggling with 1, 2, 3 things, I get victimized about it. Wewe ni mwendazimu. You've been cast and such.
Yes.
How does that now also affect those who are seeking help?
Stigma is a big hindrance for people talking about their mental health. And it takes me back about HIV. Remember when you could not talk about HIV?
Yes, you couldn't.
Because we'd see somebody with HIV like somebody who's a failure in society, somebody who is immoral. But these days we talk openly about HIV, and people are able to take medications, live long lives productively. It's the same thing. We need to know that mental illness are illnesses just like any other disease, like diabetes, like asthma, and treat those persons as people who need help, who need support, who need compassion. It is not uchawi, it is not mapepo, it is not witchcraft. It is something that is health related, and they need health interventions, both in medication, they may need psychotherapy, they may need some spiritual intervention, they need social rehabilitation and social support. Treat these people with dignity. And when we dignify the way we treat people with mental illness, knowing very well that mental illness can happen to just about anybody. It can happen to anyone.
Now,
So,
since we're talking about it does not discriminate in terms of demographic as well as gender, do we have programs that are now taking care of our youth, our adolescents?
indeed,
Where do they come in this particular value chain?
we are actually in the process of establishing or developing school mental health programs that are directly targeting the school-going children, because most of the mental illnesses, the onset is actually in those teenage years.
Yes,
Between
bullying. Let's talk about
Yes.
bullying, because we're here in the internet and we're seeing some of the crimes that are catching on. We're also talking about sextortion that is really gaining traction with this particular demographic.
Yes, it is a very, we are living in a very digital era right now, and information is accessed very easily.
Yes.
It is a good thing to a very large extent. However, it's being abused as well and can negatively impact even the person who is misusing it, because it comes back to, they say the internet never forgets. So it is very important that people learn to use the internet responsibly, because you may think that because the person on the other side is not seeing you, it's okay to bully them on the internet.
Pseudo accounts.
Yes,
Yeah.
it has similar impact as, or if not worse, because it's even going global when you target somebody on the social media. So those kind of emerging trends or new determinants of mental health, we are addressing them by also using the same spaces to educate people about responsible use of internet. And you can actually use the same internet for your own mental well-being, to promote mental well-being, not the other way around, being a cause of mental health problems.
So, Daktari, whenever we talk about mental health, and I want to use the colloquial language that is wazimu, we only think about the Mathare Hospital. What is being done to actually take, or rather increase access to mental health services across the devolved units?
Like I said earlier, we still have quite a bit of way to go, because only about 25% of Kenyans are able to access mental health services, because only about 14 counties have specialized mental health units. There you go to a hospital, it has a gynae ward, a pediatrics ward. Only 14 counties have such. We have about 1,200 beds in the whole country in public health sector for mental health.
1,000 what?
1,200 mental health beds in the whole country.
Again,
in
it's a population of around 50 million.
Yes.
And we're looking at 1 out of 5 in a lifetime.
Yes.
The statistics are not working. The numbers are not so
they're
good.
not working, well. But we do have quite a number of outpatient services across 41 counties, which they're able to improve access or service to mwananchi. However, we need to now move away from specialized unit to integration, because integration is able to bring the service close even at primary health care level. So what we've done is that we've developed guidelines that are able to build the capacity of all healthcare workers, even at a lower level, to be able to offer services. So we are disseminating these guidelines. We are training those health care workers at the lower levels, so that they're able to identify, screen, and even refer if they cannot manage these conditions. The same we also done when it comes to the community health promoters. Mental health is an integral part of universal health coverage, and therefore we're also training the community health promoters on how to identify. And to increase access, we're also covering mental health. There's a specific package for mental health care under SHA. So that improves the healthcare financing for mental health and also for treatment of
You've opened
addiction.
up now the line of questioning when it comes to funding. When we look at the health budget, it's one of the key sectors that benefit from proposed budgetary allocation. But when then we look at matters of mental health, they just receive a fraction of this particular funding.
Yes.
How does this affect the rollout of these particular services, and where then do private sector players come in?
So the mental health funding is quite low.
Yeah.
It's quite a very tiny portion of the health budget. But we've partnered with quite a number of private partners, private sector. They have funded implementation of or even rollout of some of our policy documents, training of healthcare workers. So that partnership is there so that we can even improve on what we have at domestic funding and at the government funding. The counties also now, they're investing in even training of the healthcare workers. We've seen a growth of the number of psychiatrists with almost 34 counties now have psychiatrists. Counties are now employing psychologists and counselors, but we still have very low, about one psychiatrist for about 500,000 Kenyans. So with funding, we are looking for more partnerships so that we can enhance and be able to give more care.
Daktari, parting shot now, what would be your message to someone who is watching this show tonight and is struggling with their mental health?
I would like to tell them that it is okay not to be okay.
All right.
We all struggle, but it is important to seek help. It is not a weakness to seek help when you have mental health struggles.
All right. It is okay to be not okay. That is Dr. Mercy Karanja, is the head of Division of Mental Health at the Ministry of Health. They're saying that we need to continue making inroads towards ensuring that everyone has access to mental health services across the country, calling for private sector participation in this and also increased budgetary allocation and doing away with stigma when it comes to matters of mental health, especially in the workforce. The statistics speak for themselves, is that 3.7 million employed persons or those in the workspace are facing one form of mental illness, either depression, anxiety, and substance abuse, especially alcohol at this point. Key pointers there being the discriminalization of attempted suicides that is helping also just direct the conversation around mental health. Remember, May is a month where we discuss matters of mental health, and we'll continue keeping tabs on this particular sector where experts have already said that this is a time bomb that is already unraveling. And take-home message is, it is okay to not be okay. Seek help.